All right, well, welcome. It's Wednesday night. We're going to be talking about element 20, and there's only 26 elements. So we are on the home stretch, and we have pretty much recorded all of them except for I think the first nine. So we'll go back through those and get those recorded too. So you can always pick them up on our YouTube channel, which is Nancy and Clark Peterson. And you just go on there and you choose which one you want. They tell you what it's about, and it's good to listen because you always learn something. So, just for all of you that are on live, we are going to be switching to Mondays versus Wednesdays. So, starting next week, which is what day is that? June something.
Well, today's the 20,
Today's the
it's
21st.
Wednesday, go back 3 days,
So
19,
21st,
20,
22nd,
26.
23rd, 26th. There you go. So June 26th, we'll have our next one, which will be element 21. But tonight, we're going to be talking about inflammation. And the name of the chapter is Maximizing Your Anti-Inflammation Protection. And we did this chapter this morning. We usually sit and we talk about it, we read through it, we kind of talk it over, we pull the points, if you want to know the whole chapter, you should read it yourself. But we'll pull out the important points of it. But it was a short element. But I want to say probably a super important element because it was jam-packed with information that we were like, whoa, we had no idea. We had no idea about this. So what I want to do is just I usually don't like to read out of the book, but this was such a good beginning paragraph. Really gives you a sense of where he's going with this. It says it it your immune system, okay, which we talk about a lot, right? Ever since COVID, everybody's like, oh, you got to make sure your immune system's good. That's so important. And we knew about it before, but it seemed to play a bigger role than it used to, it seemed to us, just because of the whole COVID thing. So he says, your immune system is your own personal 24/7 on call emergency service and has an incredible ability to seek out intruders such as bacteria, viruses, parasites. And in fact, it's the most complex system in the body. It not only defends us, but it remembers every battle it ever fought so it can recognize repeated threats and avoid wasting time on the harmless ones. Its purpose is to restore balance to an unbalanced body. And once it's done its job, it should settle down into its normal, vigilant state to await the next crisis. So it is your defense. It is I mean, it says it's the most complex of your systems, right? So, how important is that in your health? Like, super important.
It's your first line of defense.
Yeah, it's your first line. But what was interesting is it's not only your first line of defense, but it actually remembers what the battle was, what it was fighting, and so that it can recognize that thing again. I mean, it's kind of like, when we were growing up, my mom was like, eat dirt, because it's going to help your immune system. It's like, it's going to be like, a little, it's okay. You get a little bit of dirt in what's going on, right? Right. So anyway, all this to say, to start the chapter, your immune system is super duper important. Okay. So you may say, well, okay, that's great. Now what do I do? All right. So when your body is inflamed, has inflammation in it, which it does from a lot of different things, that affects your immune system. Your immune system is then in overdrive, okay? And it really challenges it. So, how we live our life affects our immune system. And it's more parts of what we do affect our immune system than I even thought about or realized. And I think that's what fascinated me. So that's what we're going to kind of talk about today. So when we're practicing the habits of disease, so you know how we talk about habits of health, right? Well, what the way we used to live when our body is carrying extra weight, when we're not exercising, when we're not doing these things, what we're doing then is we're practicing the habits of disease. So I just want that to sink in because it isn't just about the scale. The scale is like a minor part to what we're all talking about. We're talking about your health. And when you don't practice the habits of health, you're practicing the habits of disease. There's no like sitting on the fence. It's kind of like your faith. Either you're following Christ or you're not. It's like you're not just kind of got a foot in both sides, right? Same thing with your health. Either you're following your health or you're not. Okay. So when we follow the habits of disease, basically what we're doing is we're sabotaging our immune system because our immune system knows when your body's inflamed and you have inflammation. When you have inflammation, your immune system's like, warning, warning, warning. And then it may show up then in some kind of illness, or it may show up in 3 months, or it may show up next year, but something's going to show up when you practice habits of disease. There's just you don't get out of that. Okay. And that's why there's pharmaceuticals are so big, right? Because the doctor comes in and instead of changing your healthy habits and working with you on that, he's just giving you some kind of prescription to kind of put a band-aid on it. And I'm not saying all medications that way, but a lot of it is and can be changed with how you live your life. So what is it that affects your immune system? Dr. Anderson did a great graphic, and it's if you do have a life book, it's on page 416, and it's just this little graphic here. And I know you can't read it from there, but I'm going to talk about it because it's so it really hit home for me, and I think it will for you too. So there's a number of 3 different areas that affect the inflammation in your body. Okay, it can come from like 3 different areas. First area is, of course, what you take in, right? Your nutrition or lack thereof, right? Which is those Doritos. Anyway, so what he talks about is when you're putting in things like too many calories, refined sugars, um, let's see, high fructose corn syrup, saturated fats, uh,
Trans fat,
trans fats,
overcooked, and
overcooked food. Well, and I have to tell you, I do like those charred meats. And I'm like, probably shouldn't be eating a lot of those. Yeah, and any charred foods, it says. So what you're taking in. So when we did the element, I think it was element 16 on sugars. I mean, sugars are part of the habit of disease. And I'm not saying we don't all enjoy, a little sweet once in a blue moon, but a steady diet of that. And really, in reality, probably shouldn't have any sugars, but um, we do on occasion, right? There's always that birthday. But but that is part of the habit of disease. So that's one, it's what you take in, right? Well, the second thing is this, is the environment. So things like, I'm going to have you help me with this.
chemicals
So any kind of chemicals, right?
and toxins, allergens, um, excess UV rays and radiation.
Radiation. So, we do need to be careful of that. So, a lot of times, even if your water source isn't good, you might want to consider filters for your waters. We do that up here and in Arizona. You always want to be careful of UV rays, that, you've protected your skin. So these things, again, he relates those to inflammation and he relates them to habits of disease. Okay, so that affects your body. So, and think about it. If you're receiving chemicals, whether it's in the air and your water, whatever it is, it's going to do something in your body. It it has to, right? And then the last part he talks about is chronic infections, sinus infections. Can you read that?
Vestigial
Oh,
fat,
visual fat, so extra fat.
lack of sleep,
Hmm.
overuse of antibiotics, lack of motion, sedentary lifestyle, and depression.
Okay, so these are things that, we've done elements about your sleep. It's why Optavia does not ever want to be called a diet program, because it's really about changing your lifestyle. It's about changing, um, really the habits that you have, not just eating, but everything to create a healthy life for you. We can't fight all diseases because there are sometimes something comes up, but so many of them we can. So in the whole thing, I don't know if you picked up on it, but one of the things he talks about for inflammation is stress. Now, I never thought of that. I mean, did you think of that? Stress as being part of inflammation?
I have before that,
You have?
only because I had to. Yeah.
Well, it kind of just didn't occur to me. So if if stress is part of inflammation, what is it that you can do about stress?
Exercise is a stress releaser.
Maureen, that is awesome. And I'm going to tell you why. You read my notes because, because one thing that Dr. Anderson talks about is sitting is the most ignored health threat of our time.
What
It's
is
the
the
new
most? What is
sitting.
sitting?
And
Okay.
and he says it's the new smoking.
Oh my God.
Sitting is killing more people than smoking now.
Wow.
And you can see it. So if you go out to the store to go grocery shopping, there are more people overweight than I've ever seen. So they may not be smoking, but they're not eating well and getting out and moving, are they?
Nope.
So, right. So that is huge. So what's exciting to me is that a number of weeks ago, we put out this 60-day challenge to everybody, right? And we said we wanted people to start moving. And we did 2 weeks and talked about motion, but we also talked about then adding in exercise. And if you didn't catch that, go back and watch Element 18, Part 1 and Part 2. It's on our YouTube channel because it gives you very specifics, a structure of what to do. And we're not talking that you got to go to the gym for 3 hours a day. we're talking really 30 minutes a day and what you can do to create a healthier body, right? So when I saw that, I was like, oh man, I want to keep moving because I mean, I never smoked, but I don't want the results of, that could happen with that. So anyway, so that was huge. That was a big thing. And I just felt like we were, just moving in the right direction with getting everybody to do more motion every day. So there is another way to figure out too, or there is a good way to figure out if your body has inflammation in it. Now, you may be able to tell partly, like I know if I have any inflammation because I have a little arthritis in one of my fingers. So as soon as that starts hurting, I know it's almost always from taking in any kind of sugar. If I take in any kind of sugar, my joint hurts in my finger. It's like a barometer. I know exactly what I've done. I'm like, I shouldn't have had that. But there is a medical way that you can actually have a doctor determine what level of inflammation you have in your body. And it is called, let's make sure I give it to you right. It's called a C, like the letter C.
RP.
What is it?
Isn't it CRP?
Yeah.
Oh, okay.
Have you had that done?
Oh gosh, yes, for the last 17 years. But it's
Oh,
normal now.
Yeah, because of the arthritis, right?
Yeah.
Is that what they do that? Okay, is it a blood test, Maureen?
Yeah.
You close it up. Okay. So it's recommended, actually, Dr. Anderson's saying, so like with Maureen, because she's diagnosed with some arthritis, she has to have it done, right?
Correct.
But if you go to the doctor and he doesn't normally do that test, Dr. Anderson is saying you should request it maybe once every 4 or 5 years, just to see what level, if you have inflammation, what the level is for you.
Normal is 3 or below.
Yeah, that's what mine is now.
Well, now you say that, Maureen, is that because your diet's changed or just the medication, or what causes that?
I really do think it's a combination of things, of the medication and the fact that I have no gluten in my diet, and I'm doing this program, and I've, lost 43 pounds. And so I think
43 pounds. Woo!
Yeah. Yeah.
That is really awesome. That is awesome. So you may say too, okay, is there besides not having sugar, what else could I do to have an anti-inflammatory diet? What I'm eating. What else could be anti-inflammatory? So he kind of does a inflammatory versus anti-inflammatory. So anti-inflammatories that you want to lean towards, right, is he recommends for oils, walnut, olive, or flaxseed oil. Okay. He recommends eating fish when you can. He recommends adding some, not too many now, nuts into your diet, walnuts and pecans. Also to use good greens like collard greens, spinach, kale, things like that. Okay, so I'm not saying that's all you're going to eat. I'm just saying if you want to try to really push to that side, these are things you want to consider adding if you aren't already doing that. Now, inflammatory, and of course, when he says anti-inflammatory, he's talking about omega-3, but omega-6 is inflammatory. So he talks about stay away from things like corn oil, cottonseed oil, sesame oil, safflower oil. Stay away from margarines and any ultra-processed foods that have a long shelf life. And when we read that this morning, Clark and I are like Twinkies. They last forever, right? Janet, one of our gals, she found some Twinkies that were like, what'd she say?
2009.
Yeah, from 2009. And she said there was no mold on them and they were still soft. That's scary. I'm just saying that is scary. So think if you ate that. Oh my gosh, who knows what's in it? Anyway, so and if you want to know more about this, you can actually Google inflammatory foods versus anti-inflammatory foods and get a pretty good idea of those things, right? So the next thing is, and we had talked a little bit about stress, and Maureen piped in and said a good change to stress, which can cause inflammation, is to exercise, which actually is anti-inflammatory, right? When you exercise. So he says, so here's some other things to stop stress. Okay, he says, through much of the material we covered in the element and in previous elements can help you reduce stress. So who remembers Stop, Challenge, Choose? We've used that for eating, right? That actually is a great tool to use for more than just eating. But for, okay, here's a great example. We got some bad news about the house in Arizona.
What?
And so, well, there's it's a brand new house, right? And it's a construction issue. And it's looking like we might have to replace all the floors.
Oh my gosh.
That's what I said, Maureen.
Oh.
Anyway, so I just want you to know I did use Stop, Challenge, Choose. So, right, what happened was I first went, oh no. And of course, your mind starts racing, right? You start thinking, how am I going to pay for that? What's going to, you got a million things. Oh no, I got to tear up all the floors. What am I going to put in there? Blah, blah, blah. And so I caught myself and I stopped and I said, you know what? No one died. Well, this is not an emergency right now. It doesn't have to be done right now. We'll be fine. Something will happen. I'm not going to worry about this. And just realized there wasn't anything I could really do about it right now. And I'm just going to deal with it a little later and we'll figure something out. But I wasn't going to let it turn into, because it's easy to have that happen, right? So also dealing with difficult people. So when you have a challenging person, do you ever have that?
Which I never am.
Which he never is.
No.
But you could have that, that auntie in the family that just is difficult, or you have that friend that somehow,
Coworker.
or a coworker, right? They come to you and they're just difficult. So there was a technique, and it is related to Stop, Challenge, Choose, that Dr. Anderson uses. And he talks about this quite often. He said, when I'm with a family member or I'm in a serious meeting and someone's saying something that I can feel myself starting to be like, and your tendency, right, is you want to say something. It just makes you get mad over it or something, you could say something. So he says he always has a bottle of water or a glass of water, and he stops, he drinks the water. He said as if he hasn't kind of come down to kind of good thinking on it, he'll have some more water. He doesn't stop drinking the water till he kind of feels himself already, okay, I'm going to be okay in this situation. And then yes, but he's open and curious about what's going on. So instead of jumping to something, he's kind of trained himself to be open. The reason I share this, it's a stress, it's a way to manage stress because yes, things happen in our life. And sometimes things, really serious things happen. I mean, not that this, replacing the floor in the house isn't serious, it is, but it's not a life or death thing. And so, and there are sometimes those life and death things, and yes, and then there's grieving and there's whatever. But I'm talking about just everyday things that happen in our life for difficult people. So to keep those stress levels down, using Stop Challenge Choose is huge. It's a huge tool to do. So, and as Maureen said, exercising more frequently is another stress reliever. And this stress thing is, it's a mind thing, right? So you've got to deal with it in that way. And that's another reason that Stop Challenge Choose is so good. So between exercising and using Stop Challenge and Choose, that helps with the stress level. Does that make sense?
Yeah.
Good. Okay. Okay. Um, I was going to have you read this. So there's, the other book, Dr. Anderson, this is like, to me, this is like your big academic resource book. I have to tell you, I have never read this cover to cover. In fact, I probably have only read excerpts out of this, but it is a wealth of information. And I don't mean just about, you know, healthy foods. This thing talks about all kinds of things in your life. But there was a part he talked about, which I thought you'd all appreciate, again, about stress, okay, and how to handle stress and inflammation, I should say.
He talks about three things. Well, it talks about treating your body, relaxing, massage, that sort of thing. Then he talks about laughing. Who likes to laugh? So two of us. So laughter has been shown to reduce stress, decrease CRP, and lower unhealthy hormone levels. Watch a funny movie, tell jokes, and find time to laugh with friends and family. Or next time you feel stressed, just try wrestling up a big smile. While it may feel forced at first, smiling is the best. The very nature, see, the smiling by its very nature, smiling reduces bad feelings. So find a way to laugh. Number two, focus on the positive. It is easy to slip into negative self-image, but why say something bad about yourself that you wouldn't even dream about saying about someone else?
Yeah. I mean, so much of it you can be up in your head, right? I mean, even with the whole thing about, well, he talks about depression. So when you're feeding yourself negative things in your mind, I mean, I'm not saying that all of that leads to depression, but that doesn't help, right?
He says, find a running commentary in your mind and thought life of the reasons why to be grateful. That has to do with being positive. The last one we talked about a little bit, stop, challenge, and choose. We all have to deal with day-to-day problems. Learning to focus on the outcome you want can help you diffuse the potential stress-filled situation. So focus on the outcome you want, not the situation as it is. Revisit part 1.6. So change you in charge of yourself, setting up for successful habits of health. So those are some things that we read today.
Yeah. And so when Clark read that to focus on the outcome versus what's happening right now. And that is such a good thing to understand and to practice, because how many times Have you been good on the program? You get on the scale and you don't necessarily lose either a lot of weight or any, maybe that week. And you're like, you just want to scream, right? And get stressed and cause inflammation. But if you're focused on where you're going versus what the situation looks like right now, and you've got gratitude because you've already lost, blank amount of pounds. I mean, it changes. It's the long game, right? It's the long game. It's that you are grateful for how far you've come. You're grateful for your new habits. And yes, the situation right now may not be quite what you wanted it to be, but you're looking at what the goal is and you're looking at where you're going. And that's your encouragement, is that you're going to head towards that. So that being said, this kind of leads to something we're going to talk about in a few weeks, which is huge, which is mastering your thoughts and emotions. Because sometimes, some of us have learned over the years certain things. We still need to work on mastering those things. But he gives us a lot of great information on how to do that. But I hope as you understand inflammation and how it affects you, move you towards the habit of disease versus the habits of health, and that you understand that inflammation not only comes from what you're eating, but it comes from the environment and it comes from stress and how you deal with stress. And that exercise is a huge part of controlling inflammation. So, does that kind of give you guys a little bit of information for the week?
Yeah.
Did it stress you out?
Did it stress you out?
I think one of the things that really, I never heard it put this way, but if I'm living a sedentary life, if I'm living a life without a lot of movement, that already engages my immune system. It makes my immune system active, and I don't want my immune system active only if there's a problem. And by not being active, it's telling my body it causes inflammation and it activates that hit me hard. That really hit me hard as I studied this chapter. So that's why we're going to stay active.
Amen. Awesome. All right. So that should give you guys more encouragement to continue with motion in your life and adding exercise, because these are the things that are going to keep your body from the inflammation, because you don't want that. Is the habit of disease when your body's inflamed like that, and it's going to lead to something if it hasn't already. But there's hope. You just have to take the first step. So if you want to know more about how you can incorporate that in your life, lean into your coach. And also, like we said earlier, on the YouTube channel, listen to Element 18, Part 1 and Part 2. So, all right. And don't forget, next week we're on Monday, and we're going to be on Mondays going forward at same time, same place.
So let people know.
Yeah.
Let people know in your group and your coaches and your clients that it's changing from Wednesday to Monday at the same bat time and the same
That channel.
channel. So, all right, because we're your neighborhood health coaches, friendly neighborhood health coaches. So we'll be on Mondays.
All right, you guys, you have a great week, and I'll be talking to most of you tomorrow.
Okay, bye.
So,
Bye.
Nancy.
Yeah.
So if we eat Twinkies, will we not get moldy and stay soft?
Dale, you learned so much tonight. You learned it all. I think you got it.
Dale, you need counseling. We'll be talking to you tomorrow. All right, you guys have a great week.
Yep, right.
Congratulations for being on, man.